Hey, everybody, welcome back to Dental Unfiltered. I'm Matt Brown, and we have an awesome guest today. We have a really cool subject, something we have never approached, which is odd after 200 episodes. You would think we would have, and we haven't. I have Aaron Nicholas on as a guest today. Aaron is a coach in the space, clinical. He coaches with some of the big organizations. He works with Mark Costas. He knows Dr. Vallo really well, the co-host of the show. And we were out to dinner in Philadelphia for the Dental Boost event, and we got to know each other. And I was instantly like, we're going to get you on the show as soon as possible. I actually jumped him up ahead of the guest list because I wanted to work with him really bad. And today we're going to talk about clinical systems. We talk a lot on Dental Unfiltered about business systems and processes, like structured strategies. But I think the structured strategy and system is never really approached on the clinical side in a very executable way that creates a really good outcome. And there is a business level to that of if you're more efficient, you do more work per sitting, you can fit more in your column, and things do get better, and you just get better as a clinician, and also you are making more money. So I have Aaron on today to talk about clinical systems and kind of the mindset of that, and kind of a shift away from business systems, but a clinical system is a business system. So Aaron, first tell us a little bit about yourself, and let's dive into your view on clinical systems and being efficient.
Hey, Matt, thanks for having me on. Okay, so I practiced, I graduated dental school, 87, University of Maryland Dental School, opened a practice from scratch right away. Because I didn't have a lot of business systems, almost went bankrupt, and then crawled back out of that with a consultant. And my predilection, I guess, is to be as efficient as possible. I like to do things kind of the same way every time because that way I don't have to think about it so much. And if you have your systems kind of squared away to where they're very streamlined, then you can get ultra efficient. And then it also helps you with your outcomes because if you do the same thing the same way every time, if something different happens as a result, if your outcome is different, then you can trace it back to, okay, what was different here? What do we need to do differently? Was it the patient? Did we skip a step? Did we try a new product that isn't working as well for us? You know, exactly what's going on here and why do we get a different outcome when it was the same procedure?
You know, me and Andrew talk a lot about this. Consistency is kind of the key to success in anything, right? Is creating consistent, predictable outcome. Because then as you're going towards the target, if something comes up, you know what the destination is and you can adjust and get back on course, right? If you don't create a process for a consistent result and system, then when something comes up, chaos happens, right? And like in my former life, in the military, like bad things happen, it becomes chaos. Well, we go to what's called, revert to your training or let your training take care of you. And when that chaos happens, turn off your emotions, move on, and just let your training take over. I think when you create that, your training does take over, right? It becomes this thing like, well, I know I can get to this outcome. So when docs docs that aren't using a clinical system like you're talking about, what do you think one of the biggest barriers is for them to ever develop this? Some docs go think through their whole career and don't have a resource like this built into their daily day of like, this is my system for doing a root canal. This is my system for doing a crown. What do you think holds them back from doing this or seeing it or moving this direction?
I think sometimes it's the way they were taught. Like I always think about for myself, when they taught us to operative dentistry in dental school, like it was like you have 5 different systems for polishing this composite. Well, because they wanted you to try everything and decide what works best in your hands, which is the catch-all that they always end up using. And the dentists tend to like to use, this works best in my hands.
That sounds arbitrary.
It is. And it's like, I got 5 fingers, you got 5 fingers. Are we the same? I don't understand. And then they get out and they ask things like, okay, I'm doing a build-up and crown. I'm doing a root canal. I'm doing whatever. How long should it take me? And I've been in so many chats where some docs will come in and go, just worry about quality. The speed will come. And the truth of the matter is they sort of come together because if you do it the same way every single time, you'll get faster at it because you know what your next step is. Docs are slow because they keep switching back and forth. So they pick up a high-speed handpiece, they put a burr in it, they do something, they put it down, they pick up the slow speed, they put a burr in that one, they do something, they pick the high speed back up, they change the burr, or maybe they use the same burr, and they go back in again, and they'll switch back and forth 5, 6, 7 times in the course of a procedure, and it's just taking more time. I mean, just the act of picking up and putting down the handpiece is taking more time, much less what am I doing next? So if you're going to go, no matter where you are, if you're going to drive to New York, unless you live in New York, if you're going to drive to New York and you get on the road and you start driving, you know you can get to New York, but what's the fastest way to get there? If you have a map, if you're using GPS, if you're doing something, this is the fastest route. You get on the route, you go, you're good to go. So I'm the guy that teaches a 1-hour molar root canal build up a crown, doctor time. And all the time I hear people go, oh, you're cutting corners, you're doing sloppy work, you have to have X, Y, and Z. And it's like, no, I cut out all the fluff. I have a system for doing it. I know exactly where I am in the process all the time. So if I have 3 hygienists that come up, it's usually 2 hygienists that come over and they're tapping their foot and like, we need exams. Okay, cool. Guess what? We have a system for that too. So I'm going to jump up, go over, do the exams. But when I come back, I know exactly where I was. I'm not going to waste any time going, okay, where was I? Was I on this file or that file? Where are we in this process? I know exactly where we're going and exactly what to do next, and I'm never lost. I have a decision tree, a workflow in my head, and I know exactly where I'm in the process, and I can just keep ticking down that process and know where we are.
The whole concept of it's what feels best in my hands. I think that's the most BS answer on the planet ever. And the moment you said that, I revert a lot of stuff back to my previous job in the military. And when I worked on my surveillance team, none of us could be like, well, I like this best. And they're like, no. We all do the same thing. So we all know what each of us are doing. So we're consistent. And by the way, it's taken thousands of you as surveillance operators from Vietnam to now to figure out this is the best practice. And you, one person, aren't changing that. And we were never well, for me, doing it, jumping out of the airplane this way works best. No, we're all jumping the same way, man. We figured this out. And I feel like the docs that are saying this in school, and I get in trouble for this crap all the time, just were never good at it. They weren't fast. And their way to defend themselves is, well, it can't be good if it's fast. Listen to me. I worked in shoot houses on Fort Bragg and watched different levels of guys go through a building. And I'll tell you, the super special guys, I blinked one day and they were in a room shooting targets. I was like, how did they get down the hallway without me seeing them? Well, they do it the same way every single time. They don't randomly try crap, and they create a scenario that is consistent for them as a team where the whole team knows what they're doing. Well, in the operatory, you have your assistant. The whole team has to know what we do every single time, because not only you will get better, but your assistant will. How much do you think the predictable consistency that you create, your assistant, how much better do you think she is now? Do you make her better because of it?
Well, absolutely. And B, if she knows what your process is, it's this step and this step and this step, and doctors talk about assistants being able to read their minds. No, it's doctors that have been doing the same thing over and over again. The assistant knows where they're going next. So guess what? When you go to train an assistant, if you can say, we're going to do this, then we're going to do this, and then I need you to do this here and this here and this here and this here, then all of a sudden, everything becomes super simple to learn. Okay. And then, and maybe you don't even say that to them, but because you do it the same way every time, they're like, oh, the next thing he's going to want is this thing. And so they learn really quickly what you need next, and they can stay ahead of you and ahead of the procedure. Where a lot of docs are, they just kind of throw the assistant in there. Maybe they teach them where they want them to suction. Maybe they teach them how to pass instruments. I can't tell you how many experienced assistants I've hired who can't pass an instrument. So that's job one for us. Once you get them in there, and they've worked with you a little bit, they should be able to know where you're going. I mean, one of the things we do in the in our 1-hour molar root canal course is it's this is my system, boom, 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 boom. And docs will ask me all the time, well, I like to use this thing over here. Will that work with your system? I'm like, sure, absolutely will. It'll take you longer. I've not found that makes the results better, but it will work. There's lots of things that will work, especially as dentists. We're all gadget freaks.
You guys are bad at buying cool stuff for too much money. You guys spend way too much money on stuff that you use 10% of the time.
Absolutely. I agree 100%. So yeah, you could have all sorts of gadgets, but does it matter? And so that's always, when I do my course, I always tell docs, I'm like, look, don't add my stuff to your stuff. Learn my stuff. And then you can swap out the parts that you think your stuff works better at. And then you can assess, did it work better or not? And if it didn't, you can drop it and you still have a system that works. And I think we don't give, because they have multiple instructors in school and jobs and, and everybody's got a different product they're working with. They don't get a consistent, this is the way to do it, A, B, C, D, E, and so they're trying things and trying to figure out what their system is. And when they get enough reps, they sort of kind of have a system if they're kind of paying attention to it and if that's the way their mind works. One of my very first courses, a doctor came to me and he says, "So at home, do you?" And I just looked at him and said, "Yes. Everything in my life has a system." So your question was going to be, do I have a system for X, Y, and Z? He's like, yeah. I'm like, absolutely. Doing the laundry, when I walk in the door, when I get up in the morning, when I feed the cats, when I make coffee. Yes, I have a system for everything. It's the way my mind works.
I feel like one problem with docs is, or actually people in general, is they look at where they are and they look at what the end goal is or the objective, and they think about where I am to the objective rather than thinking about from the objective backwards. And in my world, we do what's called planning backwards from the X. And we say, okay, well, the ending is this. And then the next step before the ending is this. And then the step before the ending, the middle is this. Then you get all the way back to the beginning. When you look at where you are and say the next step I have to do is this, you start having choices on the way there, which can derail you. When you plan back from the objective, you create a roadmap in your head of the exact way I'm getting to the objective because you saw it from ending to beginning. And I feel like I'm the same way. If I'm loading up my son's dirt bike stuff in the truck to go to the track, I think about, well, what has to come out of the truck first? What comes out of the truck last? You know what I mean? Like, so I'm like, his gear bag is first, the bike is first, the gas is last, the tools are last, right? Where if you say, I got to load the truck, you're going to misload everything. But I'm planning from unloading stuff, not planning from getting everything in the truck. I think it has to be done that way. And I think people just aren't conditioned to it. So when you start teaching, is there a moment when you're looking at the crowd and you see kind of a universal aha moment where they understand like, oh, this is like, what moment during the course, like this one concept made it click? Is there one point where you think most docs realize that this is it?
I think we actually have a graphic that shows these are the steps. Every single time, these are the steps. You never go to the next step until you finish with this step. And then, so that course is like the first 4 hours or lecture, didactic, whatever you want to call it. And then we go do hands-on. And I think they understand it in their head with the didactic, but then we get to the hands-on. And a lot of times they'll come to me and we're working on extracted teeth. And they'll say, this is exactly what happens to me every time. Because no matter what I point out, it kind of goes through your brain and comes out of your hands the same way you did it before. So they'll end up doing that. They'll go, this is exactly where I had the problem before. And I'll say, okay, so let's talk about what you've done so far. Did you do this? Did you do this? Did you do this? Well, no, I didn't. Okay, let's throw that tooth away. Okay, and let's go get a new one. And then let's do the new one with the system we just talked about and see how that works. And then they do that and they're like, oh my gosh, no wonder that was so easy. And I'm like, exactly. But you got to follow the system.
Bad historical reps are creating bad historical or bad current habits. So because they've done it, and this is such a dental way of thinking, to be honest. I can't tell you how many times I hear, well, that's how I've always done it for X amount of years. And just for the docs listening, experience doesn't equal good. And just because you've done it that way doesn't mean it's the best way because you found it to be effective. I think there's a difference between just doing something and being overly effective at how you're doing it and being the best at it. I will tell you that Michael Jordan shoots a 3-point different than a kid in high school does or a high school basketball coach does, right? And I mean, not to say you're the Michael Jordan of the systems, but you're a pro at this subject. And your way is obviously be very different than the doc's way. Do you ever have a doc that like argues it with you or like just doesn't want to make a change?
Yeah, I really haven't. And I think a lot of that is because if they're sitting in the course, they're like, I have an issue. He knows what he's doing. Let me see what's going on. If I do have someone argue with me, the thing I always tell them is you get to keep all the excuses that you argue for. So if you want to get to a 1 hour molar root canal, belly crown, and doctor time, then try the system at least first before you go ahead and argue your way. I also tell them a story about when I took a impacted third molar course, and I'd already been doing extractions for a while. And I'm in there and I'm working. I got a doc behind my shoulder, and I reach for an instrument that I would normally use, and he says, no, use that other one. And I get this like flash of anger, and I'm like, I've been taking out teeth for years, and I'm like, hang on, I'm here to learn his system. Let's use what he said. And so I did, and it worked. And the interesting thing was that over the next year, had I not done it his way and learned his system, then I had 2 or 3 situations where my way would not have worked, but his way did. So by giving him a little space and actually going in and learning the system, his system, it made a big difference. The other comment I want to make is the what feels right in my hands kind of thing. And it's like something feels right because you've done it a bunch of times.
Yeah.
You know, one of the things I dread always is buying a new TV because I got to learn a new remote. I've got to learn a new way that the stupid thing works, and it doesn't feel right the first month, you know? And then that becomes my normal, and that feels great. And then if I buy another new TV, now I got to go through that whole process again. But somehow we think in dentistry, when we go to learn how to do a procedure differently, that immediately it should feel great. And it's like, it's not going to immediately feel great, you know? Even down to, I'm used to doing one-tooth dentistry, and I'm going to encourage my docs to do the whole quadrant. Well, it feels rushed. It feels like I'm not, you know, it's like, of course it does, because you're working on multiple teeth instead of one tooth at a time. But you need to know you have more time, and you can do this quadrant. You'll be more productive. Your patient sits in your chair less often, okay? They don't get appointment fatigue, because if you have to come back for every single tooth and you have a lot of work to do, they get tired of asking time off work, getting stuff ready, you know, getting the kids taken care of, or, you know, having to go do whatever other obligations they have. So the less appointments you can make for them, the more likely they are to say yes, which is getting back to business, and the more productive you're going to be clinically.
Two things when you're talking about that. One is, no matter what it is, business, clinical, being an athlete, there is no growth without discomfort and stress, right? At some level of removing yourself out of your comfort zone. For me, when I talk to my employees that are going through a lot as far as professionally, or when I used to be a Brazilian Jiu-Jitsu coach, or when I was an instructor teaching hand-to-hand combat in the military, and people are like, well, you know, this is uncomfortable because this isn't how I believe in doing it. And my answer was, well, if it's uncomfortable, we're on the right track. And I live by this adage that I try to seek as much area out of my comfort zone as possible in everything I do, because then when I do, I know I'm moving forward. If you're living super comfortable and you're on cruise control, you're not progressing, right? And I think for me, I think what you said was, you know, I'm in his course, let me try his system. I think you understood discomfort is what I need right now, this uncomfortableness of being out of it. The other thing is, you know, getting back to business, you said, you know, docs complain to me and they go, man, I just don't know when I have the time to work on this stuff on the business side. I don't know when I have time to work on the business because I'm in the operatory so much. Well, if you do that crown and build up in an hour doctor time, like you said, could you shave 45 minutes a day total across the entire column, or 30 minutes a day across the entire column, and have a few extra hours? You know, let's say you're doing a 5-day work week. Let's say it's 30 minutes, 2.5 extra hours to work on the business. Now, I think most docs are lazy. If they get that extra 2.5 hours, they go home early. Okay, or they don't come in early. I think you guys steal that. I think you gain the time, then steal it back from yourself for being productive and just become less productive. But you could get more time for the business by doing this.
First off, it's a root canal build and crown in an hour, or Dr. But that's okay. But the bottom line, so which brings up another point, which is most doctors don't know how long it takes them to do anything. In our 90-day accelerator, I make them time themselves for all these different things. So how long does it take you to do a build-up and crown? I can tell you the answer for me is 8 to 13 minutes. I've timed it 1,000 times. There are outliers, yes, but that's the average, okay? Root canal build-up and crown, about an hour. And extraction, depending on which tooth. So then you have a day, and maybe you're going to be underproducing for the day, but you have an emergency come in, or you have a patient in hygiene, or you have whatever, and then you should be able to know, I can add this without train wrecking the schedule, because it's going to take me this many minutes to do it. And we have time, I can put them here, I can put them there, I can ask them to wait a half an hour. And because of that, we can routinely add $5,000 to a day, you know, routinely, out of hygiene, out of emergencies. I love having way too many chairs with way too much space and way too many extra assistants, because I know how long it takes me to do things. And that means we're going to be pumping up the production for the day.
But you also, you know, patients can sense chaos, right? Mm-hmm. You have to practice they're like dogs. They're in a heightened fear state. Their senses are, a dog can smell fear, an animal can. They're in a heightened fear state, and they're way more, they're way more aware, right? When they're there, and they can sense chaos. And if you're calm, your team's calm, and things are moving smoothly, that creates an atmosphere of very confident space. You talked about timing yourself, and I had this vision in my head of you looking over someone's shoulder with a stopwatch and like timing the whole procedure and then every section of the procedure, and then trying to find where they can shave a few seconds off. And for me, I'm a big F1 racing fan. I like motocross racing, F1 racing is my favorite two things to probably watch with my son. And like I thought of like you're creating really an F1 like a racing team because, and not that you guys should rush, but like you're finding all these efficiencies and your pit crew is your assistant, and the two of you together can do tire changes quick, and the tire change isn't any worse. I mean, listen, a F1 pit crew can change a tire in 5 seconds. Does that mean it's worse than your dad changing the tire on the side of 95 that takes an hour to do it? No, it doesn't. It just means they're the pros, right? And they have the best tools, and they've gotten really efficient. Instead of having 5 lugs, they have one big lug in the center and one lug gun, right? And it's like really you're kind of creating the F1 kind of the F1 approach to consistent treatment.
There's a number of things. Is dentists like to piddle. So as soon as they start actually timing themselves, they tend to piddle less. So even if we don't talk about anything else, you just start timing yourself, you'll get faster because you won't piddle around with what's going on. Yeah. Number 2 is I actually have them time, you brought it up, the appointment time versus the procedure time. Because sometimes docs are like, I'm always behind. And what we find is the patient comes in on time, then they have to stop at the front desk to do financial arrangements. So by the time they get to the back, they're 20 minutes into an appointment. So of course they're late all the time because their patient didn't really arrive in the chair at the time they needed to arrive in the chair. So what do we need to do to make that happen? That has nothing to do with clinical speed. That has to do with appointment flow. But it affects how you see production and being on time and that sort of thing when you're back in the back. So you want to make sure that all the pieces make sense, and then maybe you are taking too long to do whatever. You know, it was like we had a doc that said, yeah, her really experienced assistant makes the temp. I'm like, cool, how long does that take? Oh, 25 minutes. I'm like, okay, we need a new standard. 25 minutes to make a temp is just way too much time. We need 5 to 10 minutes. Okay, so let's talk about how to train the assistant to do it in 5 to 10 minutes. Each piece does need to like get its own sort of little timing, but once all the pieces are working, then all of a sudden, you have that appointment and you just cut a third of the time out of it.
Well, you create a standard. That dentist creates his own standard, and then he knows, right? Like you said, if we're swimming in the unknown, we'll never be good. If we create the known and the awareness, we are going to be good, right? And I never thought about doctors do piddle. I shadow, I'm not just like, I'm a marketer, but like I try to go into clinic and shadow because I want to know how you guys work. So, because they working as the marketer, because I create the patient flow, right? It's like you said, appointment flow affects that. That affects stuff too, right? And it's like, you're right, they do piddle when they don't have an end date. And then the other thing too is I think so we have a saying in the military, don't train the time, train the standard, right? I feel like they have, and you can steal that, Aaron. And you can say the military is elite, trains the time, not the standard, or trains the standard, not the time, right? And like if they think they have an hour and they say, well, my finish line is 10 a.m., well, they're going to work right up till 10 a.m. And they're going to keep saying to themselves, I have 10 more minutes. If you train to standard of like, I know I can get this done in 15 minutes or 20 minutes, and my finish line is the end of the procedure, not the time, you will find yourself with excess time.
You'll figure out how to get it done more efficiently if you're deciding it's the procedure that I'm working through, not that it should take me X amount of time. Because that is one thing doctors get in their head. It's like, oh, it takes 2 hours to do a molar root canal. It's like, no, it doesn't. You don't know where you're going. You don't have a system. You don't have the idea in your head. What is it? Parkinson's law? Work expands to fill the time allotted, usually without a better result. Which was said as a sarcastic comment about the British government back in his day. But, it's everybody has seen it. Everybody's experienced that, Well,
I think too, at a much higher level, I think what we're talking about is being average versus being very good clinically, right? I feel like dental school creates average. And then I feel like the average becomes the standard because they think in their head, well, I did it to this level in dental school. And then they go into practice, and they go into an associateship, and then they do it to standard. Now, docs think I'm crazy when I say this. My very best docs that are successful come out of 2 places, Aspen and Affordable Dentures. Because I think in those front line, like that, listen, that is the front line trenches warfare of dentistry. If you can survive in one of those 2 organizations for more than a couple of years, you're a hardened, battle-proven dentist. And these guys are like calm, collective in the operatory in their own practice once they have it, because they don't have the chaos those organizations throw on top of them, right? I think you can either develop by battle-hardened scenarios as a dentist, or you can create your own by timing yourself, creating standards, and holding yourself accountable to the standard. And then you go from average to elite, because everyone that's elite in the world, everybody has a standard. Nobody in the world is successful at the top level without a standard. I think this is a standard that never gets talked about.
It's just like saying, hey, doc, worry about quality and the timing will come. And it's like, yeah, you want to worry about quality, but not in the absence of everything else. You know, if you have a roadmap, if you know where you're going, it's a lot easier to get there. We're back to that again. I was just thinking about, one of the complaints I hear from owner docs a lot is, the associate goes in to do the hygiene check. They're in there for 20 minutes and they don't get any case acceptance. I don't understand what's going on. And it's like, yeah, but no one's ever taught them how to go through a hygiene visit. Like I have like I think it's like a 6 or 7 step, I'll have to count it, hygiene visit protocol. And it's like, you walk in the door, you do this first. Now you do this. Now you do this. You ask this. You do your exam. You do this. It's like there's a step by step. And at the end, this is the way that we present treatment. We talk about what's going on. We talk about, why we want to do it. We talk about what's going to happen if we don't do anything. We give them a specific time frame, like days, weeks, months, and then make sure we answer any questions and walk out the door. And if you have that roadmap, you're in and out a whole lot faster, and you get a whole lot more case presentation, as opposed to going in and visiting with the patient and trying to, figure out what's going on. And then eventually maybe you present some treatment and then you tell them we should get that done soon, which doesn't really give them anything.
Being good at it and creating a good outcome, and people thinking that, fast can never equal good. You got to do quality and speed will come. I think we also could be focusing on one place of quality where this affects a lot of other quality. If you are better in the operatory and you are creating more efficiency there, and you're doing quality, but you're doing it, to the best of the standard you've set for yourself, I would also say the patient experience overall is better in the chair because they're out of the chair quicker. So on one side, people are saying, well, the quality of the work. Well, what about the quality of the patient experience? What about, listen, bro, I'm sorry. The mission is not that when you look in their mouth in this place they're never going to see in your body, that your work looks spectacular. It is art no one's ever seeing, right? It's art that's never get hung in a gallery. Okay, dude, that's great. You painted that awesome picture and it's in a locked closet. But what about the person in the chair and the quality of their experience you created by being more efficient and getting them out of the chair quicker?
I see patients all the time and I'll say, you need a root canal, you need extraction, you need whatever. And they're like, oh my gosh, the last one I had, it hurt so much and it took so long and it this and this and this. And then somehow I have to go, I promise it won't be like that. When I hear those stories, I'm like, I know what my results tend to be 99% of the time. And it's like, okay, I can promise you it won't take that long. I can promise you this. I can promise you that. And at the same time, I don't want to overpromise, but I don't want this patient to be living with this or waiting until it absolutely can't be restored or taken care of. And then they have to come in and then they get it done. And of course, they have a terrible experience because it's infected and things are in such bad shape that there's just no way that we're going to be able to handle this without them having to deal with that sort of thing. Whereas if I can get them in earlier and get it taken care of, and sometimes just getting them over the hump of a previous bad experience is really hard and something we kind of deal with every day. You don't want to throw the other guy or girl under the bus. And in truth, we don't know what happened. We have the patient's recollection, which is notoriously, inaccurate. But at some point, we have to figure out how to get them over that hump and get treatment and have them have a good experience. And keeping them in the chair longer is not going to be conducive to having all that stuff happen.
Well, I think also another way to reframe this is, what you guys do, your job is to do what's best for the patient all the time. And when I have docs that I'm having problems breaking through a concept with, I try to flip it around on them. And I'm like, well, let's look at the mission. Is our mission to do what's best for the patient all the time? Yeah. Is what we're talking about really best for the patient all the time? And saying like, well, the speed will come as we do quality is prolonging what's best for the patient all the time. What's best for the patient all the time is to have a great experience, get them out of the chair, have it so they want to accept more treatment later because their experience wasn't bad, and creating a standard, a path to do your procedures and timing yourself will create that, which is what's loyal to the patient. I kind of feel like, and I'm going to take heat for this, and we have to wrap up here in a minute because I have a meeting behind us. I kind of feel like patient or docs that are teaching this and say that statement, I kind of think it's a selfish statement because it justifies the way they did things.
The thing that I always think about when people say that is like, if we already have the answers, If we know what works well, why aren't we just saying that? You know, why? If we have the answers to the test and we're all taking the test and the test is in the best interest of our patients, our staffs, and our families, why not just give them the answers and then they can adjust as they want to? But at least let's have one answer that we know works rather than making them wander around in the dark, take a bunch of courses and have them put it together for themselves. Why not have at least one system that works 100% of the time? You know, and let's do that.
Well, we have to wrap it up here. I have to head out, but hey guys, this was a really great episode. Having Aaron on. Real quick, Aaron, how can someone get in touch with you if they want to explore this concept with you deeper?
They can go onto the website, which is Monday Morning Dentistry, www.mondaymorningdentistry.com, and hit us up at info there. Or I will give you my phone number and you can text me, and no one's abused this yet, so I keep giving it out. 410-207-3527. 410-207-3527. I'd be happy to have a conversation with anybody that's interested in exploring this a little further.
Cool. Aaron, this was such a great episode. I enjoyed it so much. This is something I don't really ever get to talk about is kind of clinical, but not clinical specific, step by step. This was awesome. Thank you so much for joining us. Hey, everybody, we know that there's no paid sponsors on Dental Unfiltered. Me and Andrew and the other hosts on this channel do it the love of the community. Please like, subscribe, share, follow, and please leave a review. We do read the reviews. The reviews are very, very fulfilling for us. Thank you guys so much for joining us, and have a wonderful day.
Thanks, Matt. Good to be on.